Brad Blakeman with us and Robert Wolf. Brad is a Republican strategist and former deputy assistant to President George W. Bush. He is also in D.C., but I can tell by this smiling face that he hears me very well.
I do.
And Mr. Wolf is here in New York, 32 Advisors, founder and CEO.
I may pull the I can't hear you routine.
Yeah, you're not going to get away with it sitting right next to me, former UBS America's chairman and CEO. Brad, let me start with you on health care. I mean, you think the Democrats are being upfront about this? Do they really want to work together? I mean, at the end of the day, because of the Republican control, I'm not sure how much they matter, but what's your take on this?
Well, they shouldn't get caught up in the semantics of repeal and replace. Because let's face it, there are some parts of the Republican reforms that will keep some of the mandates of Obamacare. You can keep your kid on your policy till they're 26 years old, or the ability to have pre-existing conditions and still get affordable health care. So if they scrap the verbiage and come to the table in good faith, I think Republicans, especially in the Senate, are going to have a willing ear. Look, in order for health care, a generational change to again take place in our country, it should be bipartisan because it'll affect every American.
Is there an avenue then, and you would know about this, Robert, from your side of the aisle, to look at it and say, yeah, Obamacare is not going to stay in its current form. The Republicans do have the votes to make some changes. They've already gotten something through the House. We should work with them as Democrats and make something happen. If so, what?
Yeah, I would say two things. One, they don't have the votes necessarily to make something happen to pass the Senate.
Right.
Two, I do think health care should be bipartisan. And three, I do think Obamacare needs
Aren't those first two contradictory in some way?
No. And three, I think Obamacare does need to be iterated. No question about it. But if you look at where the Republicans are and the country is, pre-existing conditions they want to hold, and Medicaid expansion, most of the Republican governors want to hold. So if those are the two bookends for the Republican plan to pass, to get moderates involved, then I think actually Democrats should be at the table to discussing.
The question, I guess, is what Democrats can live with losing. Let's listen to Majority Leader McConnell that we were going to listen to a few minutes ago, and then we'll come back, talk to Brad and Robert Wolf about that. Here's Senator McConnell.
The status quo is unsustainable. The markets are collapsing. The American people expect us to act. I understand I may be or may have gotten a letter from the Democrats saying they want to participate. Well, I would ask them to tell us what they think ought to be done, if anything. So if they're asking to participate, they must be conceding that the status quo is not sustainable. I certainly agree with that.
Well, we did hear that concession of sorts in our studio a moment ago. Robert Wolf, you said that, and I'll start with you and work in reverse order back to Brad on this, because you did say there's some changes that need to be made to Obamacare. What could you live with as a Democrat going away in order to get, say, pre-existing conditions remaining in, things like you talked about a moment ago?
I think everyone wants premiums lowered. Although in some ways Obamacare's worked because the pace of inflation of health care has slowed. Right. It's still in a rising cost environment, and so it's cost prohibitive each and every day.
But can we do it through competition, like the?
Listen, I'm for crossing state lines. I'm for much more of a market competition. That being said, I think we have to really look at the mandate, because that's important to keep costs down.
Okay, that's the question then, Brad. Do you have to keep the mandate in place?
Well, no, you don't have to keep the mandate in place, but what you can do is you can make it more appealable to the Democrats in phase 1 and 2 when you're talking about taxes and you're talking about regulation and budgeting. That's the economics of reconciliation, where I think Democrats can come to the table and we can deal with them on the dollars and cents of the new health care. But phase 3 is where I think really bipartisan support can be had. The problem is you can't get to 3 without passing reconciliation. But 3 is talking about marketability, selling across state lines. And there's a lot of purchase power that the government has that they can use to drive down costs. So I think phase 3 is going to be the easy part. To get there, you need to get past reconciliation.
Any idea on timing from either one of you in terms of and I asked that partially because I'm concerned, and we covered all the time about tax reform and when we eventually get there.
I think that it's going to be a lot longer than anyone thinks. I think getting the Senate.
Summer?
It could be. I think getting the Senate to pass this bill is going to be very difficult, and it's going to go back and forth like a ping pong, and therefore I don't see tax reform in 2017.
Right, that's a 2018 issue. Do you agree with that, Brad? Tax reform at this point is a 2018 issue.
It could be, and if we get to the fall and we don't have health care put to bed, then I think our only chance for tax reform is by the close, and I'm talking about the close of business by the 31st of January. But having said that, I'm backing up my clock from December 31st back. I think 2017 for Republicans must be a year of action because 2018 will be a year of reflection by the electorate.
Right. Midterms, otherwise you get blamed for it. Brad Blakeman,
Right.
Robert Wolf, thanks to both of you. Appreciate it.
Thank
Thanks
you.
for coming in.